Welcome back into Talking Fitchburg outside of the studio at Fire Station number 2. No, not with Adam Dorn. Adam's running the camera today, so you can blame him if there's any problems. We're with Ariana and Jeff Doslick, Fitrona EMS, continuing our series about CO poisoning. Ariana, I'm going to sit down here, and we're going to leave Jeff standing there awkwardly here. We'll bring him in just a second, but today we're going to talk about how this non-odorless gas can affect you, and more. Yep, go for it.
If there's less than 10% of CO in your blood, you won't really have any symptoms. If there's 10 to 20%, you'll have a light headache, dizziness, and flu-like symptoms. If there's 21 to 40%, you'll start having blurry vision, confusion, weakness, chest pain, and drowsiness. And if it's 41 to 59%, shortness of breath, increased blurry vision, seizures, hypertension, pounding headache, unconsciousness, coma, and cardiac arrest. If there's 60% or more, it's going to be most likely fatal.
And Jeff, this is definitely a serious thing, of course.
Sure.
When any of your staff are walking into a call of this nature, what's kind of going through your head? Because you might not even know that it's CO when you get there, but when you arrive, if you know it's CO, kind of what's the approach?
Sure. So, we know CO is an odorless, colorless, tasteless gas. So we really, if we're going into a call like that, we're allowing the fire department to go in first, making sure that they're on air and they're being safe. They have a monitoring device on the engine or the ladder where they're able to go through and wand the house to make sure that it's okay. Obviously, if we have symptoms such as the one that were just mentioned, so headache, blurry vision, those kinds of things, we're going to be more concerned and kind of have a heightened awareness of that. Once it's clear, then we'll start to treat the patient with oxygen, and if it's really bad, we may have to intubate them and take them to the hospital for sure. Hyperbaric chamber is probably going to be the treatment of choice for them. On our bag, so for example, if we go to a call and we're not, the fire department's not there, we have no idea that it's a CO. Maybe it's just a sick person, and a lot of times we'll get calls for people that are sick with flu-like symptoms. In this day and age, like right now in this time, it's probably the flu, but in the middle of the summertime, it might not be the flu. So we want to be really have a heightened awareness of that. On our first in bags, we have a CO monitor, and if that starts to alarm, we know that there's a CO problem in the house, and that we're to get out. We'll grab the patients and everybody that's in the house and get out and call the fire department to help ventilate the house.
So Ariana, let's talk about what causes CO in general.
So things in the house that can cause carbon monoxide are clothes dryers, water heaters, furnace or boiler, fireplaces, wood and gas burning, gas stove and ovens, motor vehicles, grills, generators, power tools, and lawn equipment, and smoking.
And Jeff, when you were talking about symptoms too, I've heard on some more of the serious cases that people they might be awake but not even able to walk necessarily. Like it just literally can take you off your feet.
Right. So it's a disease process that just kind of over time starts to affect you, and you may start to feel tired, you may start to have that headache, that blurry vision, and if you're really not aware of what might be happening, then you may just go like, I'm just going to go lay down, and then you just may not wake up. So we ask, for sure to have a CO detector in your house. Make sure it's properly placed. You can contact the fire department to help them guide you through that process along with your smoke alarm. And when that alarms, then get out, call 911, get out of the house, and it may not be anything, but it could be something serious, or at least it's going down the road, and just protect yourself that way.
Fantastic. Well, thank you both for your time. Sure. I appreciate it. We'll have you back on next month, right, young lady?
Yep.
Yep. We're still working on the bugs here of TV, but don't worry. We'll have her. You'll be you can take my role because I'm terrible at this. So you can have my job. I'll take your job. Sound good?
I don't care.
Ouch. Okay. Jeff, thank you so much for your
My
time.
pleasure.
I
Anytime.
appreciate it. We'll take a quick break. You're watching Talking Fitchburg.